everyone. This class we will learn cupping therapy. I'm Dr. Liu from Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. The contents of this lesson include introductions, functions and indications, classifications, techniques and precautions of cupping therapy. First, the introduction of cupping therapy. Cupping is a therapy in which a cup is attached to the skin of points or selected place to induce local congestion and blood stasis through the negative pressure created by a burning material inside the cup or drawing the air out from the cup for prevention and treatment of disease. Cupping therapy is invented in ancient times, termed as Hall method at that time, mainly for the treatment of carbuncles and furuncules. With the process of medicine, not only the materials and the method of cupping have been developed, but also the numbers of illnesses treated by cupping therapy becomes more and more, nearly covering all fields of disease. Recently, cupping therapy is often combined with acupuncture. Today, cupping therapy is popularly used in sportsmen. Second part, function and indications of cupping therapy. The cupping method has the function of circulating the materials and collaterals, invigorating qi and blood circulation, relieving swelling and pain, dispelling damp and cold. It is commonly applied for all kinds of B syndrome, such as painful joints, lumbago, low leg pain, shoulder and back pain, hammer paralysis due to wind stroke, common cold and headache. And also pulmonary disease, such as cough and asthma, gastrointestinal tract disorder, such as headache, abdominal pain, diarrhea, and dysmenorrhea. Part 3. Classifications of cupping therapy. There are 4 types of cup commonly used in the clinic: glass cup, bamboo cup, ceramic cup, and ice pop cup. Manipulations of cupping by fire. Cupping by a fire is a method that a cup is attached to the skin of point through the negative pressure by air inside the cup, which includes some techniques as follows: fire twinkling method, fire throwing method, cotton firing method. This class we will introduce the fire twinkling method. Fire twinkling method. Clamp a cotton ball soaked with 95% alcohol with a nipper, ignited and inserted into the cup. Turn the ignited cotton for 1 circle inside the cup and immediately take it out and press the cup on the selected location. This method is simple and safe, for no fire retains inside the cup. But we should avoid heating the enter of the cup in case to burn the skin. This method is common in clinic. Cupping by boiling method is a method in which a cup is attached to the skin of selected point or site by means of negative pressure created by pushing the air out from the cup through boiling. The bamboo cup is commonly chosen for this method. Based on the patient's condition, some proper herbs of expelling wind and invigorating blood circulation may be cooked together for strengthening the effects, which is known as herbal cupping method. The third type of cupping is cupping by an air pump. A cup is placed on the selected point or site, and then the air inside the cup is pumped by the air pump. The cup is attached to the skin of point or site through the negative pressure. This method is now used in family. Part 4. Cupping techniques. There are 6 kinds of cupping techniques as follows: retaining cupping, movable cupping, successive flash cupping, bloodletting puncturing and cupping, retaining needle and cupping, movable of the cup. Retaining cupping. A cup is attached to the skin of body, retaining for 10 to 15 minutes and then take off. This technique is commonly applied for all kinds of disease with one cup or several cups together, to some extent under the same intensity of absorption with the cup. A short-time retention of cupping causes local reddish change, and a long-time retention of cup causes local purple change. Generally speaking, a short-time retention is for Young syndrome, and a long-time one for blood stasis. Movable cupping. Before the treatment, Vaseline is put on the skin or the mouth of the cup, and then the cup is sucked to the skin of the disease area. Hold the cup with the right hand and slide it around the disease area and back to the original area, and remove the cup until the skin becomes congested and even purple. It is suitable for treatment of a large area with rich muscles, such as back and buttocks. Successive flash cupping. In this technique, the cup is sucked to the selected place and removed rapidly until the skin becomes reddish and congested. It is often applied for the numb and painful skin, dysfunctional disease, and especially for the patient with unsuitable to retain the cup on their body, such as children. Bloodletting puncturing and cupping. After the disinfection of the selected place, puncture it with 3H needle, and then apply cupping on the same place to bleed. It enhances the therapeutic effects on the bleeding letting. Generally, the cup is retained for 10 to 15 minutes after the bloodletting puncturing. The technique is often used for erysipelas, sprain, and mastitis, and so on. Retaining needle and cupping. During the retention of needle, a cup is sucked to the place where the needle is retained. It is not removed until the skin becomes reddish and congested. The technique has the integrated effects of acupuncture and cupping. Removal of cup. On removal, hold the cup with left hand and press the skin beside the edge of the right hand and let the air come into the cup, and then release it. It is not allowed to remove the cup by pulling or turning hard if the suction is very strong, which may injure the skin. Part 5. Precautions of cupping therapy. During cupping, the location with rich muscles is selected, and the patient should be in a comfortable and proper position. The cup is easy to drop with an improper position or uneven, hairy surface of location. Cups in different sizes are used according to the cupping location. A big cup is not easy to suck to the small area. Cupping should be manipulated quickly in order the cup is strongly sucked to the skin. It is not advised to apply cupping to a patient with skin ulcer, edema, or on the place supplied with large blood vessel to the patient with high fever and convulsion, or not to the abdominal locations of pregnant women. Conclusion: cupping therapy is a common used in clinic, and the manipulation is simple. There are various clinical indications, including exogenous disease, painful disease, and so on. Avoid burning the skin during the manipulation and pay attention to the covering indications. Okay, that's all what I teach today. Thank you for your attention. Bye.